in the arms of the angel. Fly.
Are you hurt?
Yes.
Too bad.
Do you have healthcare? No.
Too bad.
So I am here on behalf of Healthy Homes, and we are an interest group fighting for universal healthcare. And universal healthcare is healthcare for everyone, so no one has to suffer through illnesses because they can't afford it. And we are a societal type of interest group, and we have some statistics to back us up. So 20%, which is 40 million adults, can't afford or access healthcare, and it is average cost of $7,983 per year. And 44 million Americans have no healthcare, and 38 million have inadequate healthcare.
I'm going to tell you guys more about our interest group and why it's so important. First, our ideal members are those who have poor health, diabetes, trauma, need therapy, cancer, or those who have poor healthcare benefits and little money. We plan to get noticed by politicians by testifying before public officials, writing to government officials, and petitioning. Our first political official is Bernie Sanders, with a record level of 15 out of 49 Democrats back expanding Medicare into a universal healthcare insurance program. Bernie Sanders is in charge of starting the Medicare for All Act of 2017, and within it lies that universal healthcare is paid for by higher taxes. This would cover emergency surgery, prescription drugs, mental health care, eye care, and everything else in between with no copayments. It also says that employer-provided healthcare would be replaced, and the employer would pay higher taxes but no insurance, and that elective treatments would be paid by private insurers. And the Affordable Care Act is that Medicare is universal insurer, and that doctors receive reimbursement by the government. Other senators that we have on our side are Elizabeth Warren, Sheldon Morehouse, Brian Schultz, and Tammy Baldwin. They are all senators, including Bernie Sanders, for universal health care. The last person that we have on our side, as you all know, is Ken Kurt, and we have a little clip from him about what he thinks about universal health care.
Hi, this is Mr. Kurt, and I'm here to talk to you about the benefits of universal health care. Basically, we're paying for everyone's health care one way or the other. Without universal health care, everyone goes to the emergency room for every medical issue that they have, rather than regular checkups with doctors and preventative care. So basically, the universal health care allows us to get manageable health care and keep the costs down over time, because people aren't running into the emergency room, which is expensive, and it's also at the back end of it. It's not preventative. It's when something has become a big issue, when that could be solved by a regular visit with a doctor, and it's, like a small medication turns into a massive medical issue that we're paying for, sometimes for years at a time. So the idea of universal health care is provide access to everybody so that we can keep the cost down overall.
So our court case is Universal Health Services Incorporated versus Escobar. Universal Health Services Incorporated is a mental health service in Massachusetts. So this court case is about a teen with behavioral issues, and he was seeing an unlicensed counselor, and his parents were getting concerned about him. They diagnosed him with bipolar disorder and prescribed him with medication. He reacted very poorly to the medication, so they called the doctors and they didn't do anything. He then resulted in having a seizure and had to go to the hospital. Months later, it resulted in him having a fatal seizure, and this was all because he was seeing non-board certified doctors. And so the plaintiff sued incorporation. Defendant said plaintiff did not comply with condition of payment. This goes along with our interest group and shows that universal health care is very important.